Hi guys, it's Michaela here from the Mom and Baby House. Today we are filming here in Cape Town. Welcome back to our channel. We are chatting to Yolande Offord, a clinical psychologist, on postpartum depression, how it affects moms, what are some of the risk factors, and how to prevent it. I hope you enjoy. So today I would like to welcome Yolande Offord here. She is a clinical psychologist and she'll be talking to us today about postpartum depression and some of the signs, symptoms, and how you can perhaps prevent it as well. So firstly, welcome to the shop.
Thank you.
And maybe you can just give the moms out there a better idea, those that don't know what it is.
So postpartum depression is the appearance of mood symptoms and other symptoms related to depression that appear after giving birth. What is important to know though is that 50% of people that present with postpartum major depressive episodes actually develop depressive symptoms before giving birth. So
That's interesting.
yeah, so it's important to think of it as not just happening post-birth, that it can start to develop before you give birth. So we actually look at onset during the peripartum period. So during pregnancy, as well as in the weeks and months following pregnancy.
Okay. That's actually fascinating, and it's nice to know that it's before getting, pregnant and going through the whole process. So I think it would
Just
be
to
obvious.
know what's wrong with you. I think that's the biggest issue. You know something is up, but you think it's just the pregnancy. You're just uncomfortable. You're not sleeping. You're not feeling well.
Yes.
And then to know that there might be a deeper reason, because this is a very serious topic.
So my next question then would be obviously, how can a mom tell if she's got some of the symptoms before the time?
Okay, so it will be the same symptoms that will be there after giving birth. It's similar.
Yes.
So it would be similar symptoms related to depression. Now we need to understand depression is not only having a depressed mood. Sometimes you can be diagnosed with depression without having a depressed mood as well. I also want to just mention that even if you've experienced a miscarriage, for example, during pregnancy, you can also develop postpartum depression or major depressive episode. So it will be seen as major depressive episode with peripartum onset. Okay. So meaning, during pregnancy or soon after pregnancy or delivering. And it's also important to note that, as I said earlier, it's not just a depressed mood, but people can also present with severe anxiety and even panic attacks as well. And then we also need to remember that it can also appear in men. So up to 25% of men and women can be diagnosed with postpartum major depressive episodes.
Because I was about to ask you about that, and what tips would you give, a mom's partner, whether male or female, that's also experiencing it? Because out of empathy almost.
So tips for dealing with it, tips for looking out for it, or
tips for dealing with it.
Okay. So in terms of if you've been diagnosed with a depressive episode or major depression, then one of the most important things is to seek help. I think that's the starting point. People often go to their GPs, and a GP is a good place to start. They know you, they know your history, they also know how to check for the symptoms, and then they usually refer on to a psychiatrist, even though they can also prescribe medication, and to psychologists as well. So we try and work quite close with the whole medical team. We work closely together, so there's always cross-referral. Other things that you can do is, it sounds counterintuitive because you have to do things that you don't feel like doing, but often when people present with mood disorders, they tend to withdraw. They don't feel like doing things because they don't have the motivation for doing things, but then that's actually what you should be doing. So if you don't feel like going for a run or exercising, you should actually be exercising. So that's good. If you don't feel like being amongst people, you should actually go out and be amongst people. You need to eat healthily, even though you feel like eating comfort food. So those are the important things. You need to seek social support, so you need to reach out to your friends and family members that you know are caring and supportive as well. And for moms, a big support can be other moms.
Yes, of course.
So moms groups,
Always
yeah.
a good idea
Yeah.
to share. We haven't spoken about the symptoms of depression. I think if you can make that very clear so that people don't think, well, I've got some of these symptoms, do I classify myself?
I think that slots in actually what I was about to ask next about how can a mom tell the difference between baby blues and postpartum depression, because there are some correlation between the symptoms.
So baby blues refer to normal mood fluctuations or emotional fluctuations in the 3 days to 2 weeks after giving
Just
birth.
feel like crying and
Yeah.
just all over the show with your
Yes.
moods.
But
I remember that.
and it's related to normal hormonal fluctuations in a mom. So that would be the baby blues. Another way to distinguish as well whether it's just normal mood fluctuations that you're experiencing, because we all experience mood fluctuations throughout the day. That's normal human behavior.
The part, the joys of being a woman.
But also a man.
yeah, let's not forget.
So what is really important is we look at a few things. We look at severity of symptoms. We look at to what extent it impairs your functioning. So meaning if you're feeling so down you can't get out of bed, you don't want to dress, you don't want to wash your hair anymore. Not because you're tired from not sleeping, because you have a new baby.
Yes, that's completely different.
Yes,
That's quite an important one.
Yeah. And then also a sense of whether you feel you can control your mood symptoms. So whether you have a feeling of mastery over it. So if you feel
you're just drowning. If you're drowning.
Yeah. So if you
it's
feel like
time for lifeline.
you're not coping, that is an indication that you need to seek help. But if you feel like, okay, I'm feeling a bit down, but if I go for a run, I know I'll feel better. Or if I just chat to a friend, so
Doing good.
if you're like a new mom and you WhatsApp your friend and that helps your mood to lift a bit, then that might be normal baby blues. But as I said, if you're feeling completely overwhelmed by your emotions, you can't control it, you can't cope, your functioning is impaired, but it's also when it causes you distress or other people around you distress.
That's watching you, because sometimes the family would notice it first.
Yes.
I would
Especially
like
the partner.
to just draw the attention to a few stats that I got, that at this stage in time there's 300 million women in the world suffering from postpartum depression.
Crazy.
300 million, that's like insane.
Sure.
And what was interesting is if you have a predisposition to anxiety or mood disorders, then the chances that you are going to suffer from this is quite high. I think the stats I got, it's about 30 to 35%. So I think for us that are a little bit anxious and have the odd panic attack, we should just be more aware that when we go through this process that we might be more susceptible, is that the right word? But just be more sensitive to your own inner world.
Yes, that's very important. Often when people are feeling overwhelmed by their emotions or when they are depressed, it's actually difficult for them to be in touch with their own inner world. So that is also an indication. So like you mentioned, when you have previously had struggles with your mental health or have been diagnosed with a mental illness such as anxiety or depression, it puts you at greater risk for developing postnatal depression. But you can also try and manage it during your pregnancy. Just check for the symptoms carefully after you've given birth. And then there are a few other risk factors as well. So it means it's not things that will cause postnatal depression, but
make you maybe more susceptible.
It makes you more susceptible, or it goes hand in hand. So
yes, of course.
Some of those risk factors are teenage pregnancy. Another one is, like we said, predisposition. That means if any of your family members has a history of mental illness, you are more likely to develop mental illness.
Marital conflict.
Marital conflict, definitely.
Financial problems.
Yes.
I'm sure you can write a whole book on that.
So those would be your additional stresses as well. It's important to, if there is marital conflict, for example, to sort it out. If you're trying to fall pregnant, to sort it out before you fall pregnant. If you are pregnant, to also sort that out. Being a single mom, can put you at greater risk. There is substance use or substance abuse can also be a risk factor. And any other stresses, changing job, moving house.
Yes, I think part of the general preparation for moms should be, as they plan their birth plan, plan your social support system once the baby is there, just to preempt it, to maybe think, well, I might have the blues, I might have something else, so let me get my mommy group set up, know where they are, what times do they meet, etc., etc. I just think we need to look at it from
so that would fall. That would be part of your protective things that you can do. So it is making sure you have enough support. So just because you're a single mom doesn't mean you will develop postnatal depression.
Yes.
If you have, again, it depends on your family history of mental illness, your own history, your own coping skills. So if you want, you can see someone before to help develop your coping skills. It's also, other protective factors would be attending antenatal classes, just so that you...
What do they do? They think they have it? What should they do?
Okay. The most important thing that I say is listen to your family and your friends and medical personnel. If they notice that you are not well, listen to them. Now, for me, one of the biggest resources are the clinic nurses.
Because they go there quite often.
You go there every week in the beginning. For the first 6 weeks, you go every week to check in. And they often, they're trained to pick up on the symptoms, and they often would say something to you. So it's to listen to them. When you go for a checkup, again 6 weeks after giving birth, then as well listen to medical personnel when they note.
Or ask your questions, because you've got somebody there.
But they usually would check in with you,
ask you.
to ask you how you're doing, how you're coping, and just be honest.
Don't be superwoman then.
Superwoman is one of the things that is also can put you at risk wanting to be superwoman.
It's a fact.
Yes. And the thing with depression is that if you treat it quite early on, the prognosis is quite good.
Okay.
So within 6 months to a year, you can do quite well. And I see a lot of moms that come and see me quite soon after giving birth, and there's often a very notable and quite a good shift in their mood symptoms that I've noticed.
That's great to know. I think once a mom has established some of the signs and symptoms, and even if they have the necessary resources and support systems around them, they still might not open up or seek help. Do you think that's because there's a bit of a stigma against, you don't want to say to other moms, actually I'm not doing that well after birth, I'm actually struggling?
So there's a stigma around mental health in general.
Yes.
That people don't want to admit.
So we're still in the dark ages,
Unfortunately. We're getting there.
But it is improving a lot. I must say, I have noticed that there is a big shift and that it is improving. So, the media can have beautiful things about motherhood, but sometimes it's also quite a skewed view. Everybody thinks they need to feel this gush of love as soon as they've given birth, or they need to have enjoyed their pregnancy, or they need to immediately bond with their child. And there's such guilt around not being that media mom, or the image that's portrayed in the media. And that perpetuates the depressed mood, but it also makes it difficult for women to reach out and say, I'm actually struggling with this. But it's actually that reaching out which is going to help you
and strengthen.
And it's interesting you pick this up when you're in a social situation with friends. I've picked it up many times where you have one or two that would just say, their pregnancy was just such a joy and blah blah blah, and then I'm like, well, I'm going to speak the truth. I hated being pregnant. I was as huge as an elephant. I kid you not, 22 kgs I picked up, and I always say to them, well, that was not my experience, and it was terrible. And I just leave it there, let it simmer, because that is reality. Some of us enjoy it, our bodies are made for it, and some not. And I think, it should be said, and then not judge.
She always says to me, 9 months of pain for a lifetime of happiness.
Yes.
I get to say it in a video.
But that is true.
Yes.
I did it twice, so
True.
say something.
Do you have kids?
Yes, I have a son, he's 2 now.
Okay. Oh wow, that's so young.
Yes.
Oh, such a baby. Well, I think all of our questions have been answered, and I'm feeling quite confident about this topic. Do you feel
Yes,
comfortable?
I do. And I think it's a strong message for moms. Don't
Definitely.
be superwoman. Get your social support strategies like you would do your birth plan. Get it ready before birth. It's essential. Life is tough enough. It's even going to get tougher, but with lots of joy, many years of joy. But yes, be well equipped emotionally, and we thank you for your time.
It's a big pleasure.
Thanks so much. Enjoyed that video? Please remember to give it a like, subscribe to our YouTube channel, check out our Facebook page, and stay tuned for our next video coming up. Hope you have a lovely day.